Thromboembolism is the formation in a blood vessel for a thrombus that breaks loose and is carried out by the blood stream to plug another vessel. Silent features. Most common sites of thrombosis are deep femoral, popliteal, posterior tibial. Less common sites are axillary, jugular vein, iliac vein, external and iliac vein, ovarian vein, prostatic plexus, subclavian vein, uterine vein, venous sinuses of dura mater. Etiology: traumatic occurs usually in a traumatic lesions of lower extremity, especially fractures of the long bones. Non-traumatic 10 to 20% of fatal pulmonary emboli occurs in the absence of trauma. Predisposing factors are general debility, especially in the older, leading to poor general circulation and poor cardiac output. Immobility and bed rest causing stasis in the veins, especially those of leg. Economy class syndrome, development of deep vein thrombosis and pulmonary embolism occurring after long duration flight in economy class with the cramped spaces. Predisposing factors are prolonged immobilization, venous stasis, and dehydration, hemoconcentration. Although not related to trauma in any way, it highlights the importance of immobility and dehydration in causation of thromboembolism. May also occur after long travel in rail coach syndrome, bus travel syndrome in similar condition, local tissue damage causing injury to the veins, time of injury. Thrombus typically form within 10 to 20 days of injury. Cause of death in pulmonary thromboembolism, right-sided heart failure, acute cord pulmonary, acute asphyxia, vagal inhibition, autopsy. A noticeable fullness of pulmonary artery is seen before the vessel is opened. Pulmonary emboli may be confused with a post-mortem clot. Pulmonary emboli can be identified by the following characteristic. They are cylindrical in shape with a parallel contour. They often show a branching and curled. Their shape does not correspond to the place where they were found lodged. It corresponds to where they originated. For details of post-mortem, infarction of lung is not seen in lungs when main pulmonary trunk is blocked. It is seen when the artery to the bronchopulmonary segment or small vessel is blocked. The most common mechanism of thromboembolism: thrombus is formed in the leg veins as a result of injury, injury pressure and stagnation. Eventually, it gets detached and travel upwards to lodge in the pulmonary arteries. Stagnation, pressure, injury, formation of embolis causes two fat emboli impacted in the left pulmonary artery. One bolus travel towards the heart pulmonary. Tissue components. Tissue embolism is the obstruction of a blood vessel by a body tissue. Common tissue emboli are bone marrow embolism following fracture of bone, brain embolism, trauma, including gunshot injury to the head. Chronic embolism can cause death during abnormal gustation. Liver embolism in hepatic trauma, skin embolism from venous puncture site, transition epithelium embolism from severe ulcerative urethritis, tumor cell embolism for amniotic fluid embolism, miscellaneous embolic phenomena. Foreign bodies can be embolized or bones occurs in trauma-induced septic bone lesion after bone surgery, after bone marrow transplantation, and normal remains silent. As a bone chip do not usually occlude the vessel lumen. Over time, the endothelium covers the bone fragment. Also seen in gunshot wounds of the head. Bullets are commonly reported in hydrogenically introduced object, hypodermic and radium needles, IV catheter, cotton fiber during angiography, pinza needles, thrones and wooden fragment.